and professional development programs, just as our Young African Nutrition Scholars, the YANs, Learning and Expert Exchange Hub, Emerging Leaders Research Grant Award, etc. Our base is in Nigeria, where we have a broad team of experts across the various geopolitical zones and in diverse areas of nutrition and development. We are also expanding to other African countries. Our YouTube channel is an extension of our commitment to knowledge sharing, capacity building, and community engagement. Here you will find a wealth of resources designed to empower researchers, nutritionists, and anyone interested in nutrition and public health. One of our flagship series is the Learning Hub. This webinar series is aimed at equipping researchers with essential tools to enhance their research competence. Whether you're looking to master statistical software like SPSS, NVivo, or learn nutrition-specific tools, our Learning Hub series has got you covered. We bring experts to guide you through practical hands-on sessions, ensuring that you not only understand the tools, but also know how to apply them effectively in your work. Another exciting series we offer is Expert Exchange. This series highlights the work of nutritionists across different sectors through engaging interviews and discussions. You'll gain insights into their experiences, challenges, and successes. It's a fantastic opportunity to learn from the best in the field and be inspired by their journeys. Each episode is designed to provide you with valuable knowledge and practical advice that you can apply in your own professional practice. Aside from our Learning Hub series, our Expert Exchange series, you can expect to see other content which can include excerpts from speaking engagements, interview sessions, to highlight the work that our members do in NDDI and lots more. Rest assured that we are committed to providing you with value through our YouTube page. So expect to see top-notch content. We are excited to have you join our community. Make sure to subscribe to our channel. Hit the notification bell so you never miss an update. Leave a comment, let us know what topics you would like us to cover in our webinar series for future videos. Your feedback is invaluable to us. Follow us on our social media platforms at NDDI Africa for more updates and join our mission to promote healthy diets and improve public health. Thank you for watching, and we look forward to embarking on this journey with you. Hello, Dr. Francine. Again, hello, Dr. Caroline. Hello, everyone. Welcome to the day 2 of our session on Nova screening for ultra-processed foods. And today we have 2 of our facilitators, Dr. Francine Santos and Dr. Caroline Costa, who are from Brazil, the Center for Epidemiological Research in Brazil, and we're going to have them all through this session. Please stay tuned, and if you know any of your friend or colleague, anyone who should be on this call, please, we'll be starting right about now, and it's so very important that we have you engage with us all through the session. Today is going to be more of a hands-on session, more practical, and so it's very important that you do not miss this. As a way of introduction, my name is Uju Honora, and co-moderating with me today is Temitope Ayebose. So we welcome you again to this program, and we are very excited to have you on the day 2 session. And we'll be starting right about now. So I'll be handing over to our first panelist, Dr. Caroline Costa, my apologies, who will take us on Nova UPF screener. validation in Brazil, adaptation for other countries like Senegal, particularly as a case study. And I'm sure you're a bit interested to know more about who Dr. Caroline Santos is. So just sit back. Please hold on. Let's go and share. Dr. Caroline, please hold on. Let me introduce it, and then I would I would get right on. Yeah. So Dr. Caroline Costa is a nutritionist. She graduated from the Federal University of Pelotas, UFPEL, Brazil, and she holds a master's degree and a PhD in epidemiology from the same institution, from UFPEL, and she is a collaborating researcher at the Center for Epidemiological Research on Nutrition and Health, NUPENS, at the School of Public Health, University of Sao Paulo. And during her period as a postdoctoral researcher at NUPENS, Dr. Costa has worked on the development and validation of a short instrument to capture the consumption of ultra-processed foods in Brazil. So you can best believe that she is one of the best hands to actually take us on this topic. She also supports the adaptation and validation of the tool for dietary assessment or integration into monitoring and evaluation systems in other countries. So thank you so much, Dr. Caroline. It's a pleasure to have you join us today. And I will just let you have the floor and stop sharing. You can share a screen. Thank you.
Thank you. Thank you so much. Let me just share my screen. Okay, so hello everyone. Good afternoon to all. First of all, I would like to thank to NDDI for this invitation. It's a pleasure to be here with you today. I would like to highlight that the main title of this webinar is focused on the novel screener for ultra-processed foods, but my speech will mention the experience from our team in Brazil about the Nova 24-hour screener as a whole, which is a screener that allows to generate two simple scores, not only a score for ultra-processed foods, but also for unprocessed and minimally processed whole plant foods, in order to monitor and benchmark population diet quality. I've been working, as Dr. Uju mentioned, I've been working on this topic since the beginning of my postdoc with the team from NUPENS at the University of São Paulo in Brazil. And at some point of this presentation, we will focus specifically on the Nova UPF screener and score, just to mention this to you. So, when we talk about diet quality, the first question that came to my mind is why we need to evaluate and monitor diet quality in populations. So first of all, there is a global consensus on the benefits for health that are achieved with diets based on unprocessed or minimally processed plant-based foods. So fruits, vegetables, whole grains, legumes, nuts are all food groups that have been linked to diets with balanced nutrient profile and also with protection against malnutrition, cardiovascular diseases, and also mortality, since the classical studies about the Mediterranean diet. So at the same time, besides the knowledgeable benefits from natural whole plant foods, as we saw yesterday, there is a growing and robust body of evidence regarding the effects on health from diets based on ultra-processed foods. And today is well known that ultra-processed foods are associated with overall deterioration of the nutrient profile of the diets and a higher risk of several non-communicable diseases and also mortality. Here is the same slide that my colleagues showed yesterday, but just to recap, here we have an example of a consistent evidence from multiple countries supporting the dietary share of ultra-processed foods as a measure of diet quality. So we can see here in this graph, in this set of graphs, an increase in the energy intake, in the contents of saturated fat and free sugars in the diet, and a decrease in the content of protein, fiber, and micronutrients with the increase of UPF consumption. And to recap here too, we can see an exponential number of studies that have been published evidencing the deleterious effects of ultra-processed food consumption on health outcomes. And this consistent evidence has been summarized in several systematic reviews and meta-analyses published in the last few years, actually, and some of them about the higher cardiovascular risk and higher risk of type 2 diabetes, obesity, and other health outcomes in general, and also mortality. And here, just some examples of meta-analysis that use data from high-quality cohort studies, longitudinal studies, showing significant pooled risk ratios for overweight, obesity, type 2 diabetes, depression, cardiovascular disease, and death, and also all-cause mortality, evidencing this deleterious relationship between ultra-processed foods and health outcomes. And finally, a last reason for studying and evaluating diet quality is because ultra-processed foods are the most rapidly growing food industry sector around the world. And we know that patterns based on ultra-processed foods have been replacing traditional dietary patterns based on varieties of unprocessed or minimally processed foods, even in the African region. So monitoring the diet quality can allow detecting these potential shifts in food consumption that we are seeing around the world. So it seems essential to monitor diet quality. I think we agree with that. But a second question is how we monitor diet quality. Most of the previous mentioned studies on the effects of ultra-processed foods on health used more complex tools to evaluate food consumption. For example, 24-hour recalls, food frequency questionnaires. But this type of questionnaires, of tools, in many contexts, difficults the monitoring and evaluation of diet quality using these traditional tools. This can be difficult or not factible due to the lack of resources, of human resources, of time resources for data collection, and mainly in low and middle income countries, for example. So considering this scenario, we developed a short 24-hour recall screener aiming a practical way to capture the dietary intake of these two critical novel groups and to calculate the scores that could reflect these intakes. And how this screener is, how is this screener characterized? So this screener is a 3-minute questionnaire. It's really, really quick and easy to answer. That counts on 2 lists of foods. The screener has a focus on the food processing degree based on the NOVA classification. And in the first list, the tool counts on selected foods from the less processed group, so the unprocessed or minimally processed foods. And here we choose to include a list of foods restricted to those for whom there is no doubt about their relationship with a balanced diet and protection against diseases. So totalizing 33 items. And on the other side, we have a list of subgroups of ultra-processed foods, totalizing 23 items. And both lists were defined based on the most common or most consumed foods here in Brazil. So here for the less processed group, we ask about the consumption on the day before of 10 varieties of fruits, 9 leaf vegetables, 9 other vegetables that are not leaf, and 1 group of legumes, 3 varieties of whole grains, and 1 group of nuts. And on the other side, for ultra-processed foods, we ask about subgroups of 6 ultra-processed beverages, 10 products that usually replace or accompany meals, and 7 products often consumed as snacks. So both lists are presented in a checkbox format that I will show in the next slide. So it's really quick and easy to answer. So here is how the list of ultra-processed foods is presented in the app, in the application. So here, my apologies for being Portuguese, but it's just to show you how short and easy to complete this tool is with this format, this checkbox format. So the participant only has only to check all the items he or she consumed on the day before the application. Okay, so from these 2 lists, it's possible to calculate or obtain 2 Nova Diet Quality Scores from the simple sum of positive answers in each list of foods consumed on the day before. So we have then the Nova WPF score, which corresponds to the number of unprocessed or minimally processed whole plant foods, and the Nova UPF score, which corresponds to the number of subgroups of ultra-processed foods. So each item or each category counts 1 point, and then we just sum the positive answers from these lists. And just to highlight that both scores were proposed to be proxies or estimations of actual population dietary share of unprocessed or minimally processed whole plant foods and of ultra-processed foods. And here about the validation in Brazil. So we have published a first study evaluating only the ultra-processed food component of the screener, which was performed in a convenience sample of 300 adults in the city of São Paulo in Brazil. And this study showed that the tool presented a good performance in reflecting the percentage of energy intake from ultra-processed foods. But recently, we published another study that evaluated the performance of both the Nova ultra-processed food score in a wider sample and also the performance of the Nova WPF score in part of the Nutrinet Brazil sample, which is the largest cohort study in Brazil evaluating diet and health outcomes, and about which Francine will give more details soon in her presentation. And you can know more about this study. So to evaluate the performance of the tool, about 800 individuals answered firstly the 3-minute screener, and then an open-ended 24-hour recall, which was developed and validated specifically for the Nutrinet Brazil study, which is also a tool that focuses on the food processing degree. And we compared the scores from the screener with the percentage energy from each group. So the scores of the NOVA WPF score of the NOVA WPF compared to the percentage of energy from unprocessed or minimally processed whole plant foods, and the scores of the NOVA UPF against the percentage of energy from ultra-processed foods. In using this data collected in the Nutrinet Brazil, we described the distribution of the scores and the mean dietary share from the 24-hour recall according to the intervals or quintiles of the scores. So we compared both tools using similar intervals. And we calculated then the agreement between the score quintiles and the quintiles of percentage energy from each group. So here we have the first results of the validation in Brazil. We can see here the first graph of the paper, which shows the distribution of the NOVA WPF score and the NOVA UPF score in this sample. We can see that the distribution of the NOVA WPF score is almost symmetrical, is more well distributed across all the points, the range. And for the NOVA UPF score, we can see that the answers are more concentrated in 0, 1, 2, or 3 points or items of the list. Then what it did was to divide the scores in intervals, or what we call approximate quintiles. And we described the mean dietary share of whole plant foods and ultra-processed foods obtained from the full 24-hour recall according to the quintiles of each score. So as you can see here, we have in this figure A, here we have the percentage of total energy from whole plant foods, and here we have the intervals of the NOVA WPF score. And we can see that there is a direct and linear relationship between the two measures. So the percentage of total energy from whole plant foods increases linearly and direct with the increase of the intervals of the score. And the same we see here in the figure B, where the percentage of total energy from ultra-processed foods increases directly and linearly according to the increase of the scores of the NOVA UPF score. And finally, we have here the distribution of the individuals according to the NOVA WPF score intervals and the corresponding quintiles of the dietary share of whole plant foods. So with this distribution of individuals, we found a substantial agreement between the two measures according to the PABAC, which is a kappa adjusted for prevalence and bias. Here we have the results for the NOVA UPF score, and we can see that we found also a substantial agreement between the intervals of the NOVA UPF score and the quintiles of the percentage of dietary intake from ultra-processed foods. So For both scores, it's important to highlight that we evaluated the agreement for subgroups of the population, and we confirmed the substantial agreement according to regions of the country, also for sex, for schooling level and age range. So all these levels of the population also presented a substantial agreement in similar values of kappa for the agreement between the two measures. So just to conclude this part of the presentation today, from this set of results from the validation in Brazil, we can conclude that these two diet quality scores based on NOVA classification capture it's possible to capture a range of unprocessed or minimally processed whole plant foods and of ultra processed foods. This set of results also show that the tool present a good performance against 24-hour recall measures of food consumption based on the NOVA classification system. And we can conclude also that this tool can facilitate measuring and monitoring the quality of diets by using data from a low research burden screener, which presents potential to be used in or adapted for other countries. So this represents a possible tool to be applied in monitoring and evaluation systems around the world. So just an interval and we can continue. The second part of this presentation today, we will be focusing specifically on the NOVA UPF screener, as I mentioned before. So although we have this screener that also includes unprocessed or minimally processed items or categories, which includes the healthy component of the diet, when we started the adaptations and validations for other countries, we started from the ultra-processed foods component of the diet. And why we did that? The main reason for that is because ultra-processed foods are almost universal. So they barely change across countries. I think you would agree with me. Mostly changing only the examples or the brands that are better recognized. So it would be easier to start from that point when compared to unprocessed or minimally processed foods that are the most consumed in Brazil are probably different from other countries due to cultural diversity. So we focused on ultra-processed foods and the NOVA screener for ultra-processed foods in these adaptations for other countries for this because of these reasons. Okay, so the project that started the adaptations and validations for other contexts was funded by IMANA, the Innovative Methods and Metrics for Agriculture and Nutrition Actions from the ANH Academy. And this project was developed in 3 low and middle income countries. Its main goal was to adapt and validate a short food-based screener, the NOVA UPF tool, to capture ultra-processed food consumption. And Professor Carlos Monteiro led this project. And to choose the countries that would be engaged in this project, we had these 3 criteria, these 3 main criteria that are the existence of national health or nutrition surveys that would allow countries to systematically monitor trends of UPF consumption. Also, strong partnerships between our research group in Brazil and in-country institutions. And also a country-level policy efforts that would complement the work done in this study. So the 3 countries selected were Ecuador, India, and Senegal through these institutions. And here we have the pictures of all the researchers that were involved in the project. So it was a great project that was finished in 2023. The last activities also finished in last year, 2024. So the first step of this project was to propose an adaptation protocol that countries could follow to have a basis from where to start to adapt the tool for their context. So, of course, that this adaptation protocol was a first suggestion that could that the countries could make adaptations in this protocol to consider the in-country specificities. And here we have the step-by-step breakdown of activities proposed in this protocol. So the first step to determine what we call of content validity, so the validity of the content of the tool, would be a first literal translation of the Nova UPF tool that was originally provided in Portuguese to the appropriate language in each country. So in Ecuador to Spanish, in India to Hindi, and in Senegal to French initially. The second step, the tool would have to be confirmed for appropriateness of the categories of ultra-processed foods, and also existing context-specific data would inform the selection of the appropriate examples of UPF items within each category. So this was the next step to consult context-specific data to check the content of the tool. And options of data sources that could be used at this stage include national dietary intake surveys, national purchase surveys, regional surveys with information on popular brands, and also a certain top food and beverage brands as the Euromonitor, for example. So based on this context-specific data, 2 or 3 most popular brands would be chosen as examples that could be easily recognized by the population within each ultra-processed food category, as the same was done in the tool in Brazil. So we provided these 2 or 3 brands in the categories of ultra-processed foods. Then the ultra-processed food categories, along with specific examples, would form the first draft of the adapted tool. This version of the tool would be then evaluated for appropriateness by an expert panel. So we suggested to have at least 15 experts in the field of public health nutrition, epidemiology. They would be identified in each country, and they would be invited to determine the content validity of the tool. So the expert inputs could be obtained in different forms, depending on the feasibility in each country. We suggested they could develop online surveys, for example, using the Delphi methodology, where the items of the tool and their examples would be evaluated for appropriateness. And also we suggested to have a virtual panel discussion with the partners and experts in case of no consensus, for example, in the rounds of the online surveys. So from these steps, further adjustments in the tool and revisions could be made in consequence of the panel. And finally, the last phase with the of this adaptation protocol would be the phase validity, what we call phase validity, where we suggested to select a purposive sample of 5 to 10 men and women from each country to fill in the tool, the questionnaire, and evaluate clarity, ease of understanding, interpreting, and also responding to the NOVA UPF2. So the inputs from the participants would be considered and incorporated in the final version of the tool, which is here the final step. So, of course, as I said before, this adaptation protocol was a suggestion and a starting point for the partners to develop the adaptation. But as you can imagine, the reality was a bit different depending on the context of each country. So here in the left, we have the 3 products that were published from each country in relation to the adaptation of the tool. And here are the titles if you want to see later in more detail. In Ecuador, for example, so what were these peculiarities from each country, right? In Ecuador, for example, they already had data from the national survey of the country, the ANSANUT. And this was great, a great starting point for them. But on the other side, they decided that the tool should not be self-reported, self-completed, but applied by an interviewer. So they had to adapt the tool for this application by an interviewer. In the case of Senegal, for example, which we will see in the next slides in more detail, the country did not have information from any source besides Euromonitor. So to better inform the adaptation of the tool, they decided to develop a market survey. So it's important to highlight that this was done during the COVID-19 pandemic. So this was only possible in Senegal because the situation was favorable in the country. But the realities are different across countries, and a different scenario was found in India, for example, which was greatly impacted by the pandemic period, but they managed it and developed a literature review, followed by an online grocery retailer scan for food label reading in order to map the types of ultra-processed foods in Indian food markets. So you can see that even in the making part of the same project, each country had their peculiarities or need for adaptation for their contexts. Okay, so now we will focus on the adaptation for Senegal to provide you with some examples of a context that could be closer to yours. So the aim of this study in Senegal was to adapt and validate against the 24-hour dietary recall this short food-based screener to assess ultra-processed food consumption in the Senegalese context. So here I provide more details about the steps done by the partners. that were pretty close to those proposed by the team in Brazil, but with some changes and adaptations. So after the translation, the first literal translation of the Nova UPF2 to French, the Euromonitor reports were mainly consulted, and due to the absence of national data, 2 steps were taken by the partners in this country. So the first one was to consult experts on various domains using the methodology that we proposed, but also they developed individual consultation sessions and not only the group consultations. And also they developed a market survey, as I mentioned before, to capture the diversity and main types of ultra-processed foods that were available in the food supply. So identifying almost 5,000 types of packaged food products, and from which this almost 5,000, 70% were ultra-processed foods and were listed to be classified into different subcategories. So this consultant with experts happened both before and after the market survey, and helped to determine the content validity of the adapted tool for Senegal. So for the last step, which we call the face validity, the tool's design, content, structure, ease of understanding was evaluated in a convenience sample of 25 individuals and conducted in 4 different languages, among these most commonly used in Senegal. So the questionnaire applied to these 25 individuals, this convenience sample, assessed specific topics related to the tool. So the understanding of the wording of each subcategory, if the respondent had no difficulty in answering the tool, if he or she had understood the meaning of each category, if the proposed ultra-processed food subcategories corresponded to the food products, for example, to which they were often exposed, and also if the examples used were clear and well recognized. After the results from this step, this face validity step, further minor adjustments to the phrasing of the questions were made. And finally, after these adjustments, after the face validity stage, the tool for Senegal was finalized, and it has this look, which is a bit different from the tool in Brazil. We can see that for Senegal, we have yes or no questions, different from Brazil, where we have the checkbox format. They thought that it would be better understood in this way. We have also images that we don't have in the tool in Brazil, and also a detailed description in the bottom of the images, besides the brand examples that we have here in the tool in Brazil. So here we can see in more detail the first category, which is in French, and I apologize, but it's just because it's the original tool for Senegal, and we can see in the original tool the examples here, the brand examples, and the images in a more close picture. So we can highlight here also the description that they include in the bottom of each category. of each image. And this category, for example, they explain that includes non-alcoholic flavored drinks that are made from water with added carbonation, sweeteners, and other permitted food additives, and so on. So this is to help the participant to understand what foods, what group of foods we are asking about their consumption. Okay, so with the adapted tool in hand, the final step was the criterion validity. When we compare the adapted tool with a well-established and more robust tool, as we did in Brazil. So in this case, a larger sample was selected, so using a multi-stage random selection in 25 urban census districts in Dakar. The households were randomly selected as well in each district, considering the size of the district. And in each household, one adult was randomly selected. And finally, a total of 301 individuals answered the NOVA UPF screener first, and then the 24-hour dietary recall informing about all foods and drinks and also the total amounts that were consumed on the day before the interview. In this more robust and complete tool. So for the analysis, the partners evaluated the agreement between the NOVA UPF score intervals and the quintiles of the dietary share of ultra-processed foods. Here we have the first results of this validation in Senegal. So we can see here the score for this tool. We can see that most answers were around 1, 2, 3, and 4 points. And we can see that 10.3% of the individuals had a score of 5 or higher points in this tool. And I brought here this information because it's interesting to compare to Brazil, for example, because in Brazil, when considering a national survey, the scores of 5 or higher are found in 14.3% of the population. So we can see that we have here 4 percentage points higher the score when compared to Senegal. So here they are comparing the percentage of total energy from ultra-processed foods from the more complete tool, the 24-hour recall. And here we have the NOVA UPF score quintiles. So the same that was done for Brazil, we can see that with the percentage of total energy intake from ultra-processed foods increase according to the increase in the intervals of the NOVA UPF score. And this increase has a statistical linear trend. And finally, here we have the distribution of the participants according to the quintiles of energy intake from ultra-processed foods, from the full 24-hour recall, and the NOVA UPF score quintiles. So with this distribution, we can see that a near perfect agreement was found between the two methods, even better than we found in Brazil. So they conclude that the score obtained with this tool accurately reflects the level of energy intake from these target foods. So the result from the validation in Senegal was really, really great. Okay, so to have a break, and we are proposing here that we take the tool with your hands and complete it. So we ask that you please take a few minutes to recall all the foods and drinks you consumed yesterday, from the moment you woke up to the time you went to sleep. You can access the Nova UPF screener for Senegal using this QR code, using your phone, or through this link to Google Forms. You will complete the tool, and in the end of the after you answer the questions, you can see your own score that will be calculated from the positive answers to each category. So we will put this link also in the chat. Just a minute. And here. And now we can have a break in the to answer this tool.
And I think the link was not to go to the chat, the Google Forms.
Yes, I'm sorry. It was directly to NDDI. Now, yes. Sorry. Sorry, everyone. So we have here 10 answers. I invited you all to participate, to engage, and complete the tool for Senegal. The tool is a bit more complete with examples and brands and images. So it would take a few more minutes than the tool in Brazil, but I think 5 minutes is kind enough to answer. So I invite you all to know your score. We have now 30 answers. Let's hold 2 more minutes. And then we can give the floor to Francine to continue the presentation. And in the end, we will see a summary of the results from this activity. Thank you. So thank you, everyone. I think we can go forwards. NDDI, someone wants to present Francine?
Hey,
Mm.
thank you, Dr. Caroline, for that beautiful exposition on validation of the Novus tool and its adaptation in Senegal. Thank you. So right before I introduce Dr. Francine Santos, who will be taking us on dietary assessment for health outcomes. Please, I know you may have questions, right? So if you have questions, please feel free to drop them in the chat box, or you note it down on your own personal, notes, right? We would have a dedicated section to take your questions right after all of our presentation. Thank you. So I'll be handing over to Dr. Francine in a short while, but it might as well just be very good that you know who is coming right on board. So I'm just going to give a bit of introduction on who Dr. Francine Santos is. So she's a nutritionist with a master's degree in nutrition and food and a PhD in epidemiology from the Federal University of Pelotas, UFPEL. She's a researcher at the Center for Epidemiological Research on Nutrition and Health, NUPENS, at the School of Public Health, University of Sao Paulo. And she's also a professor in the Department of Nutrition at the Federal University of Health Sciences of Porto Alegre. Her research expertise lies in food and nutrition policies and nutritional epidemiologies, focusing on dietary patterns based on food processing. So you know that you are in the right hands for this session. So join me to welcome Dr. Francine Santos. Please drop something in the emoji in the chat box and emoji. Just let her know that we are welcoming her. Thank you so much, Dr. Francine. It's a pleasure to have you on this session. So please, you have the floor. Thank you.
NDI for the invitation. And also, I would like to give that it is a pleasure to stay here in this second day of our webinar. So in this presentation, I will talk about the dietary assessments for healthy outcomes. Then I will present the results from two studies at the WHO that we developed in the NutriNet Brazil cohort studies, that we tested the association between these both Nova dietary quality scores with healthy outcomes. Next. As we discussed in the presentation from day one concerning the public health impacts of ultra-processed foods, there is a robust body of evidence that ultra-processed foods increase the risk of metabolic diseases such as overweight, obesity, and hypertension. Several, in the presentation of day one, I show for you several prospective cohort studies that had their results summarized in meta-analysis studies and a randomized clinical trial. And there is this robust and growing body of evidence. These studies were performed using traditional methods to evaluate the dietary data, such as 24-hour recall or food frequency questionnaire. Then the assessment of the performance of the NOVA UPF score and NOVA WPF score. With these outcomes, weight gain and hypertension that are important, relevant public health diseases, is a way that add in that phases of the validation of these tools in that Carol mentioned in her presentation. Next. First, I would like to show you the data set of these studies, and Nutrinet Brazil cohort study was mentioned several times during this second day. And the Nutrinet Brazil cohort study was designed based on Nutrinet Santé, a French study launched in 2009 in France. And Nutrinet Brazil was launched in 2020 in Brazil. Professor Carlos Monteiro is the lead of this project with Professor Renata Levi and Professor Maria Laura Lousada. This study, the primary aim is to investigate the prospective association between characteristics of diet and healthy outcomes related to chronic non-communicable diseases in Brazil. And this study is conducted by the Center for Epidemiological Research in Nutrition and Health, the NUPENS, from São Paulo University in Brazil. And next, Carol. And Nutrinet Brazil cohort study is a web-based prospective cohort study. Then I think it can inspire you in your searches because it is development in a middle income country and is a web-based cohort. In Nutrinet Brazil, we included adults aged with 18 years old or more from all regions from Brazil. All participants are volunteers in this study, and they need to access through internet because all questionnaires, baseline and follow-up questionnaires are applied in our website, the platform of the Nutrinet Brazil that you can see in the picture of the slide. It is an open cohort. Then there is a continuous enrollment since January 2020, and now more than 100,000 participants in the study. And diet is, and we use two instruments to evaluate the diet data. First is the 24-hour full recall. It's the complex instrument, and the 24-hour rescreener that Carol explained in the first presentation. And also we collect, the Nutrinet Brazil collect data of healthy questionnaires every 6 months concerning to self-report of medical diseases, validate scales of symptoms, results of exams, prescriptions, and other questionnaires concerning to lifestyle characteristics such as physical activity, sleep duration, tobacco, alcohol consumption. And these are variables important to collect because the main objective of the Nutrinet is to study the diet of the participants, the Brazilian population. We need to know this data, especially as covariates and in the adjustment analysis. This picture is only to illustrate it is the data collection timeline of the Nutrinet Brazil. Now we are in the 5th year. Then usually we consider the first year as the baseline period because Nutrinet Brazil is a web-based cohort. Then we needed to split the questions in several questionnaires because the questionnaires don't to be so long, and it can the participants could choose any questionnaires do not to fill all questionnaire if we use instruments so long. Then now we are in the fifth year of follow-up this cohort, and the picture illustrates all questionnaires that were applied and the future questionnaires that will apply in this study. Next. And this, I apologize because it's so short, but it's only to describe what are the health conditions investigated in the Nutrinet Brazil study. You can see that we study metabolic and endocrine disorders such as diabetes, obesity, and hypertension, and other cardiovascular disorders, digestive, respiratory, autoimmune disorders, cancer, neurological, and so on. Next. And it is to show you what are our recruitment strategies. Nutrinet Brazil use several recruitment strategies through campaigns using traditional media in television, radio, newspapers, and institutional websites, as well as the social media, and in the participation in scientific events. You in the right pictures is part of the Nutrinet Brazil work team, using the T-shirt of the study in a national scientific event. And also, there is other strategies to reduce the follow-up losses. For instance, the certificate of the participation and a relatory after the participants answer the 24 recall. Next. Just to remember, because in the first presentation today, Carol explained this too, but Nova UPF score and Nova ultra-processed food score are estimated from this Nova 24 diet recall screener. And this screener is applied in the Nutrinet Brazil cohorts. Here, the first study that I will show for you the results, the main results, is this study that was published in the Public Health Nutrition in 2023. If you would like to access the complete paper, here is the QR code. Next. Novel diet quality scores and weight gain. Some aspects of the methodology of this study. We used the dietary data by average scores obtained in 3 non-consecutive days, randomized, assigned over 2 weeks, 2 weekdays, and 1 weekend day. Then the participants in the baseline study received, when the participants answered the first questionnaire, they fill the first Nova 24 screener, and after they received notifications to answer other two screeners in a period of 2 weeks. The outcome of this study, weight gain, was estimated from self-reported information in the questionnaires. Weight changes assessed from baseline to 50 follow-up. The mean follow-up duration was about 15 months. And how the participants, it's a cohort study. Then the participants could be different time of follow-up. Then we standardized the outcome to the same to 50 months duration. It's similar adjustment, but the outcome variable was standardized. Next. I returned this figure just to show what is the period of we used data from this study. We used the baseline period in the first year of the Nutrinet Brazil, and the weight and a questionnaire from the second year of the Nutrinet Brazil, that is our follow-up measurement of the weight. And concerning the statistical analysis of this study, we used the Poisson, crude, and adjusted regression models to assess the association between quintiles of each Nova Diet Quality Score and the risk of 15-month BMI gain of 5% or more of the initial BMI. So we had the continuous variable of weight gain. Then we used the dichotomic variable concerning this definition, the gain of 50% or more of the initial BMI. It is the list of the variables that the covariates that we used in the adjustment models. Then there is socioeconomic and demographic covariates, lifestyle covariates, and BMI in the first model. And we did additional adjustment for the quintiles of the other dietary score, and also performed a mediation analysis to investigate the proportion of the total effect of each Nova Diet score on the risk of the outcome could be explained by the alternative Nova score. And going to and now the results of this study were included in the analysis. 9,551 participants after exclude the individuals with implausible values of weight, BMI, in the pregnancy woman, and several criteria to define the individuals that remained in the analysis. Also, implausible values of BMI during the follow-up. And our final sample was comprised by the majority of the participants are women and adults in the middle age, and with 12 years or more of education. It is when we add this descriptive data, the Nutrinet Brazil population is more, there is a participation, the participants of the Nutrinet Brazil are more, have more education and are women than compared to the Brazilian population, because it is a web-based study. Then it's not a population-based study, but the primary aim of the Nutrinet is to study the associations in the prospective associations. So this population study with these characteristics is possible to answer our main outcome. Following this description of the sample in this study, about 5% of the participants were current smokers. More than 50% of the participants are active practical, and about 15% did diet for weight loss. And also in the graph is possible to observe that the almost health population of the Nutrinet Brazil have overweight. And it is a graph that tests the linearity of this the association between NOVA diet quality scores and weight gain. And we can to observe in the left figure WPF score. There is it's not, there is a negative association, but for ultra-processed food score, it's possible to observe that is a positive, and those response association, it is more clear to observe it. And we also use the restrict cubic splines to test the dose response, and the test was significant for linearity for those response for novel ultra-processed food score and weight gain in this study. It is the table, the frequency and relative risk of the weight gain according to quintiles of NOVA diet quality scores in the Nutrinet Brazil. We can observe that increases in quintiles of the NOVA UPF score and decreases in quintiles of the NOVA WPF score were both direct and linearly associated with increased risk of weight gain in all models, including the additional model that we adjusted for alternative score. But for the NOVA WPF score, it's possible to observe that the estimative were more attenuated when we did this additional adjusted than to NOVA UPF score. and it's but both maintain the association. And now I will present the preliminary results. It is a study that we test the association between novel diet quality score and hypertension, also in the Nutrinet Brazil cohort. And it is the timeline again, the data collection timeline again, and we can in this analysis, we used a follow-up period, and we are using the data up to 5 years of the Nutrinet Brazil study. Next. The preliminary results. I apologize because I omit in this presentation the results of quintiles 3 and 4, but how these data are not these data were not published, but it's possible to compare lower versus higher consumers, and for Nova UPF score, it's possible to observe that in the all models, individuals in a protective association with hypertension, and for the Nova ultra-processed food score, individuals in the higher consumers of this score presented greater risk to hypertension compared to lower consumers. And these results are, and we confirm this result using the continuous score. And thanks, it's what I would like to present concerning the studies of the Nova diet quality scores and healthy outcomes, studies that were developed in the Nutrinet Brazil cohorts.
Thank you so much, Dr. Francine. Thank you for that exposition. Thank you so much. Again, please, right before I'm going to be handing over to Dr. Caroline, and right before I do that again, if you have questions, you can also drop it now in the chat box. We'll take it right at the Q&A session, or you would probably note it down. So I'm going to be handing over to Dr. Caroline, where she will take us on integration of this tool for national surveys. Dr. Caroline, you have the floor. Thank you.
Thank you so much. I will try to be brief. Then we will have time to do a practical activity and to have the Q&A session. I will just share my screen again because I was putting the results of your answers to the Nova UPF tool that I will present in the end of this last presentation. So I will bring here a few examples of applications of the Nova UPF screener and also of integration in national surveys in Brazil. So Here's just to illustrate that besides the project funded by the IMANA, that included Ecuador, India, and Senegal, several other partners from various institutions contacted us asking for support, or in applying the same tool from Brazil in their countries, or in adapting and validating the tool for their contexts. So including all these countries listed here. Through the IMANA project, we also had the opportunity to disseminate the tool in various ways, including 2 learning labs that are showed here, and firmware from one of them, Malawi, which is one of the countries listed in the previous slides, contacted us asking for support, for example. So these dissemination events were really important to disseminate the tool. So here we have another example of a country that adapted and validated the tool for their contexts. In this case, in Colombia. They found that besides a substantial agreement between the 2 methods compared, the NOVA UPF score was positively and significantly associated with sodium, total fat, and saturated fat intake, which is really important to aggregate value to the tool. And the team in Brazil has also initiated this evaluation also for our context in our country. In relation to the integration in national surveys, we have some examples in Brazil. Although the tool is not exactly the same, it has been applied through telephone interviews in the digital study, which is an annual survey that monitors NCDs, risk factors, in Brazilian adults. And we have already a time trend of 6 years, where we can compare the trend in UPF consumption with the trend of obesity prevalence, for example. Our tool in Brazil has also been used in school-based adolescent health surveys and also in population-based health surveys. And we can mention that some partners from other institutions, as showed in the map, are starting to adapt and validate the tool for other age groups, including children, for example, with our support. Here I bring more details on the digital study in Brazil, which was actually the first version and the first time that the NOVA UPF screener was applied in our country in 2018. This first version had a list of 12 unprocessed or minimally processed foods and 13 ultra-processed items or subgroups investigated on the day before the interview. And in the same way was built based on the dietary patterns of the Brazilian population. But it's important to highlight that they were applied through telephone interviews and not self-completed as the tool that has 23 items in Brazil. You can see here, and apologize again for being Portuguese, but just to show you that the lists, both lists started shorter because the tool was applied by interviewers. And when we needed a tool for self-reporting, in the case of the Nutrinet Brazil, which is completely developed by the internet, we had to dismantle the food items in more items to be better understood by the participants, and now allow to include more examples and brands to help the understanding. So here just to show you the trend that was evaluated in the Vigitel study through telephone interviews. We can see here that the frequency of adults who consumed 5 or more groups of ultra-processed foods on the day before the interview has remained stable across the years, varying between 8,000. In here, just to, sorry. Okay, so here's just to mention that the school-based adolescent health surveys in Brazil use the same questionnaire of Vigitel applied in 2019 and 2024. And the population-based adult health surveys, which is a household survey in 2019, also applied the two. But here again in Portuguese, but just to show you that it's a more concise or streamlined list to fit in the questionnaire, because the questionnaire asks about several other topics, not only food consumption. And it's also applied by an interview, so they had to reduce the questions. And just to mention that, because I am here talking about integration in national surveys only in Brazil, but it's important to highlight that the project, the MANA project, and the partners involved in the project, although they were not able yet to implement their tools in national surveys, they are all committed to do it in some way. So let's go to the practice activities. I would like just to first show you this graph with your answers. So first of all, thank you all for the engagement in answering the Nova UPF screener from Senegal. We had a total of 45 answers. So we can see here the distribution of the points. We can see that most of you follows the most answered points, around 1, 2, 3, 4. And we have here a mean, an average of 4.5 points, a median of 3, and an interval of 0 to 23 points. So, but we can see that the number of UPF consumed by you guys were mostly around 1 and 4 or 5, and just a few of you consumed more than 4 or 5. So this is just to illustrate to you how the tool and the score works. And you can see that it's really easy to calculate the score and have these results. And I would I'd like to take this opportunity to thank also to the team of the MANA project, especially the team in Senegal, which provided a lot of information to build this presentation. And okay, so now we have 20 minutes left. We have also to have a time to the post-test questions. But I would like to ask you just to take a few minutes to reflect based on the content present over the 2 days of the webinar, all the content presented related to the NOVA classification system, to the public health impacts of ultra-processed food consumption, and also the presentations of day 2, more specifically about the screener and the score. I would like you take a few minutes to reflect on the following. So how is the discussion on ultra-processed food consumption and related public health policies evolving in your country? You can put in the chat and we can comment on some answers, or you can also just reflect on that to eventually collaborate with your country in some way. Also regarding the Nova UPF screener for Senegal, do you think adaptations would be necessary for your country, for example? And if so, if you think adaptations would be needed, what types of adaptations would be needed? And a last question is, does your country have data available to inform potential adaptations, such as the most consumed ultra-processed foods or the most commonly consumed or recognized brands to be included as examples? So I would like just to ask you to reflect on these questions. And in relation to the Nova UPF screener for Senegal, if you need to see again the tool, you can access in the link that we send in the Google Forms. You don't need to answer again, but you can look at the items and the examples and the brands, and you can reflect on that. You are all invited to contact us if you are interested in using the tool or in adapting and validating if necessary to your country. You can contact us by email, and we will provide you the necessary support to do this in your country. But I will take here and stop here, sorry, and you can put some messages in the chat.
Thank you, Dr. Caroline. Thank you so much for this practical session on integration of the tools. And I'm pretty sure that questions, right, reflections and comments on the reflections would drop in with time. So, but while we, wait around for that, would also as well take the post test just because of time, and then we can jump right into the Q&A. I'm pretty sure that would have questions coming, and then we could also have a more extensive conversation. So, okay, some questions are already coming in. So let's just get right into the post test. So everyone, thank you for staying true to this point, right? So we're just going to have a poll up on the screen in a short while. It's more or less like a post test, just to know, and access to just to assess you personally. It's not your name is very anonymous, right? Just to know what your knowledge gain has been like in this past 2 days on the Nova tool. So I'm putting it up. Please fill it up and know that it's totally anonymous. So yeah, you'll see it in a short while on your screen. Thank you. Okay, so please, I'm guessing it should be up on your screen now. So please, again, I encourage you to fill and just to assess you personally, and to know how far you may have come on this training. Please take the poll. Please take the poll. We just want to know how effective this training has been for you. It's no one is scoring anyone, right? We just really want to know how effective this training has been in terms of improvement in knowledge for you. So please take the test. Someone is saying she can't see the poll. Can someone confirm? I think a couple of persons have failed, but is there someone else having this challenge? Yes, we encourage you to fill the poll. Just a very small number has, please. Let's get on and just see how well we have improved on our knowledge base for this webinar. No one is filling. Please, 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 please. Also, I'll just give about 2 more minutes, right? Again, like I said, this test is fully anonymous. It's strictly, and you can also scan the QR. Okay, there's a QR code on the chat box. Please, also, if you want to, take the post test, not right on here, so you can also scan the QR code for this. So 2 more minutes and we would have to close this, sadly. So please get on board. Okay, we're coming up. We're coming up. We're coming up. So 1 more minute, 1 more minute, 1 more minute. So feel if you haven't. And also, if you have questions, you can also as well, if you're filled, right, and you have questions, you can also as well start dropping it, right, because we are jumping into Q&A right after this. So if you filled, thank you to those who have filled. Hey. All right, we're going. 1 more minute, 1 more minute. Please, let's fill this. It's so important because we want to know how well you have improved on your knowledge on this. So this data is actually important to, get to be able to assess this properly. So please, a minute more and I'm closing the poll just so you know. So please fill, and then yeah. seconds. Okay. Think I'm going to close the poll now. Okay, since okay, hold on. And let's see what our result looks like. Can you please can someone confirm if they can see the results of the poll? Yeah, it's some. Can you see it on the screen, please? Can you confirm? Right, just so you know, for those who failed, right? So I'll just give you a minute, go over the questions, you see where you failed, see where maybe you could have made some adjustments, and then I will close this. I will jump right into Q&A. Hey, I think that's just right about it. I'll stop sharing. Thank you. Right. Okay, at this juncture, I'm going to hand over to my co-moderator, Temitope Ayebuse, for the Q&A, right? So please drop your questions in the chat box. Temitope, please, you have the floor. Thank you.
Thank you so much. It is an amazing moment, Dr. Caroline and Dr. Francine. Thank you so much for the wonderful presentation. It's a very fantastic one. We've learned a lot, and I'm grateful as a person to be here to listen to you guys. So we'll be handling the question and answer. The question I have before me here from one of our participants, God's Power in Person. What are the steps involved in adapting the Nova screener to a specific country food environment? First question. The second question, what are the potential uses of the Nova screener based on the Brazilian experience, such as insertion in national health surveys? Question number 3 from same person. In what ways can the Nova screener help in measuring and monitoring the risk of non-communicable diseases? I think
So I can, yeah. Sorry, could you please go ahead.
Okay, so we have some sub-question under the question. Are there policies and regulation to reduce production of ultra-processed foods?
Okay, so I can start answering, then I can give the floor to Francine, but I think pretty most of these questions were answered during the presentation. The steps involved in adapting the Nova screener to a specific country's food environment. I have presented the adaptation protocol that we suggested for our partners in the IMANA project. Of course, these steps can be adapted to a specific country's food environment because not all of the contexts have, for example, national surveys to base their adaptation of the tool. But in case of Senegal, for example, they developed a market survey. So the steps involved in adapting are mostly related to the content of the tool, so the content validity. And for evaluating the content validity, we need some other steps, like having studies to base, to know what types of ultra-processed foods are mostly consumed in the population. Then you can consult experts, for example, to help you in evaluating the content of the tool, if the content is appropriate to that context. Then the next step would be the evaluation of the face validity, when you you apply the tool to a few individuals to understand if they thought that the tool was easy to answer, if some category is not clear enough, test the time that lasts to answer the tool, and several other topics. And finally, the final step would be the criterion validity, when you compare your results from from your tool to the results of a more traditional tool like the 24-hour recalls. So this would be, in summary, the steps involved in adapting the Nova Screener. The potential uses based on the Brazilian experience, I think I mentioned also the insertion in national health surveys. We have been used the Nova Screener since 2018 to monitor and evaluate diet quality through the Nova Screener, both the scores of ultra-processed foods and unprocessed or minimally processed foods, so the both sides of the diet. And in what ways can Nova Screener help in measuring? Yes, I think this question is the answer is the same, because Nova Screener can help measuring and monitoring the risk of non-communicable diseases when we have these results of the score annually. For example, for Brazil, we have in vegetal study the annual estimates for this score, and we can then make associations, studies to relate to obesity and other non-communicable diseases. So I think most of it was presented here today, and you can also review, as said by NDDI, that you can look this on YouTube again. So Francine, not sure if you...
I would like to get the link concerning the last question. According to who, the inadequate diet is one of the most modificable factors relationship non-communicable diseases. Then when we have these instruments, these tools such as Nova Screener to monitor the diet quality in distinct contexts and countries, especially in situation that is not possible to collect data with complex instruments such as food frequency questionnaire or 24-hour recall. We can the Nova screener are available, and of course, according to the context of each country, but it is a way to monitor the diet data of the population in the several countries, and in indirect way monitoring the risk of non-communicable disease. And I would like to comment. I saw in the chat that the focus is on low and middle income countries, but I think all countries in the world are in risk. I think high income countries such as UK and US achieved a plateau in the ultra-processed food consumption, but low and middle income countries are the more risk, because we are observe that the consumption of these products are increasing really fast in low and middle income countries. Then it's necessary to develop instruments and tools such as the Nova screener to monitor, because it's important to have the data. If we do not have the data, it's difficult, the policies and programs development, and I think we need to all countries in the world are in risk of concerning ultra-processed food consumption, and of course non-communicable diseases.
Yes, I think we
Thank
have
you so
one
much.
more question. Yeah.
Thank you so much for the clarification, Dr. Caroline and Dr. Francine. We're very grateful for that. So we have another question here, and I think this question is not like a question. I think he's asking if he could contact you guys because he would like to use maybe the Nova screener in his country in Ghana. That's the question. That's just like an opinion. So the other question I have here. Sorry.
Yeah, I will put in the chat our emails again if you want to contact us. Yes.
Okay. You can just help us put the mail so that for those of us that want to contact you guys, they can actually do that. So this question says, this study seems to focus more on the low income countries, but I think developed countries are more at risk. Is there any justification? Because it seems that all the studies, all the results were just in Senegal and other low-income country. So, and most of this problem, based on what probably their opinion, they feel that most of this problem is found on high prevalence in the Western world or in the developed countries. So, is there any justification for that?
Yeah, I think this question is just what Francine was answering before. Because yes, you are right. Then higher income countries are more at risk than lower and middle income countries. But at the same time, higher income countries present a stable percentage of dietary share of ultra-processed foods at a high level. So a plateau, as Francine said. And it's difficult to change something in that level. But of course, the policies are working on that. But at the same time, low and middle income countries are increasing their consumption of ultra-processed foods rapidly. So we have to have tools and strategies to lead with that rapidly too. So because of that, it's important to have quick tools and tools that can be used in countries and contexts that have less resources, for example, and these quick tools can help to monitor and evaluate the consumption of ultra-processed foods to be able to, make policies and actions based on data, because several contexts or countries that are showing these rapidly sales, for example, of ultra-processed foods, don't have enough studies or don't have any studies about the consumption of ultra-processed foods. So we think that the tool would be a great help in knowing this risk. And just complementing, there's a question related to the tool specifically, if the tool, the questions of the tool are standardized with regards to adaptation. So yes, they are pretty similar across the countries because ultra-processed foods mostly are. But as I said, they were changed in a way to consider the in-country specificities. So as you can see here, I will put an image in the chat, which is from the paper developed by the partners in Senegal. Here they are comparing the original tool in Brazil to the adapted tool in Senegal. They are kind of standardized, but the examples and brands are different to consider the products available in each country. And also they put together some items and included 3 other items that were not in the tool in Brazil because they were not mostly consumed by our population. So they are pretty standardized, but each tool in each country has the in-country specificities.
Thank you so much for the clarification. I don't think there is no other questions that we haven't attempted and make clarifications to. We're very grateful, Dr. Caroline, Costa, Dr. Francine, and Dr. Marcos. We thank you for the wonderful presentation. These 2 days webinar have been an amazing one. We've learned a lot. It's well informative and it's very enlightening. And me as a person, I've learned a lot, and I think I'm now well equipped for the future to use your tools and to also adapt many of what I've learned from this webinar. Thank you so much. For those of you that you're asking about the slides or the presentation, you can go through our YouTube. You can rewatch all of our program there, even the past one we've done. When you go to our YouTube, you can see all of those things there. For people that you don't want to miss out from all our engagement, you can subscribe to our newsletter, and also you can join all our social media handles, NDDI Africa. You can join us and you can get more engagement with us in the future. Thank you, and do have a wonderful evening. We'll be concluding this 2 days webinar now to the glory of God. And once again, thank you, Dr. Caroline. Thank you, Dr. Francine, and thank you, Dr. Marcos. We're very grateful. Thank you so much. And happy evening for every one of us. Thank you.
Thank you so much, everyone.
Thanks so much.
All right. Thank you so much. Bye.